so there are stages to endometriosis, and the stages should not be something that people feel justifies or diagnoses their severity of how they're experiencing this, right? The stages of endometriosis are really a criteria that are most beneficial for healthcare practitioners, researchers, and such to be able to try to quantify how far and how vast they see your endometriosis. And that is really important for, say, things like giving advice about medical management or surgical management, but it doesn't necessarily reflect on your personal experience of your endometriosis, right? Your pain might be severe, even if the stage that your doctor talks about is only stage 1, right? And so that in itself kind of creates often, again, this miscommunication between people who are suffering with their symptoms and why is it then that my doctor doesn't believe me, or that my stages or my diagnosis doesn't reflect that, right? And so the stages themselves, again, we'll whip through these really quickly because we have so much we want to cover today, but it's a progressive thing as to how much disease there is. And a lot of this can only be figured out once you have surgery, right? So that we can see this. So stage 1 endometriosis is that there's like only a few little bits here and there. But when you get to stage 2, it can be deeper. These may have been there for a longer period of time. You don't start off with stage 4 endometriosis, right? You start off with stage 1, and then it kind of gets deeper as you go through menstrual cycles. It progresses. The red circles here are showing where the stages are getting more. So cysts, so if those endometrium or those endometriosis implants are on your ovaries, then every month when they bleed, they can bleed and then bleed and bleed and bleed, and they just make a bigger and bigger sort of like blood blister kind of on your ovaries or somewhere. So having these endometrium or these endometriosis, or sometimes they're called chocolate cysts, on your ovaries can be part of the diagnostic criteria. Whether or not that gives you symptoms or not of pain and such is variable, right? And then severe being that not only is there lots of it, but it can be farther away, right? There are people who can have endometriosis that's up on their diaphragm or in further areas.